In the heart of Yorkshire, our health service is hard at work.
Emergency department, Barnsley Hospital.
Just relax, mate.
A dedicated team
Stop making me laugh.
working 24 hours a day, 7 days a week.
Look forward for me.
Trainee coming through.
Ready for anything
I think I'm just about got it cracked, this job.
and everything.
Everybody clear?
Any pain at all? No.
Still alive, still alive.
Well, you're stuck with me now.
Wow. I'm down, boss.
Lucky you well.
Facing life
We're back from the moon.
and death. Trauma
Keep going, sweetheart.
and tears.
I'm not.
Supporting each other through the toughest shifts.
God help me today.
I'm not coming on, Ken, it's lovely and warm.
Is this cut then? Is it like this big or is it like this big?
Buckingham Palace one day, Barnsley Hospital next.
Oh, lovely.
It's like champagne.
This is Barnsley Casualty 24/7.
God bless the NHS.
On shift tonight, Deputy Medical Director Jo Behan,
We might lose power to the site if we don't reduce demands.
Emergency Nurse Practitioner Jo,
Quite a bit of that bone's gone there. Don't know where it's gone to, it's probably still on blade.
and Sister Vicky.
Working during the hottest day of the year. Let's see what today brings.
So, get ready to share a shift with the team at Barnsley Casualty. It's the hottest day on record.
Temperatures in South Yorkshire are expected to rise to 40 degrees. People are being advised not to travel unless it's absolutely essential.
Trains are cancelled, roads are melting, but life in Casualty carries on regardless.
Are you moving patients from yellow to blue and vice versa?
Running a very hot hub today is Sister Vicky.
You've just got to put your experienced head on and think, right, take a deep breath. This is what I need to do. This is what's going to make the department safe.
A difficult day lies ahead.
We've got currently 24 patients in department, 1 in resus, and we are working during the hottest day of the year. So let's see what today brings.
And within minutes, an emergency is on the way. Paramedics are rushing in a woman who's collapsed in the street. Registrar Eamon Staunton takes the lead.
Well, we don't know the difference between in a taxi, the house, really short of breath.
Yeah.
Initially, she had a pulse at respiratory arrest.
Yeah.
We got her onto ambulance and went into cardiac arrest.
Yeah.
She were in PEA initially,
Yeah.
then went into asystole,
Yeah.
and then she had 2 adrenaline,
Yeah.
and we got ROSC about 5 minutes ago.
Yeah.
An asystolic patient's heart has flatlined and immediate treatment is required.
Things may look dramatic from the outside, but part of what we do is manage difficult situations, and actually, even if it might seem dramatic and chaotic from the outside, we're always completely in control of what we're doing.
She's had a cardiac arrest. Yeah. We've got her pulse back. She's not making any effort to breathe for herself. The blood pressure's a bit low. Might arrest again. Yeah. So we've stuck her on the ventilator. Just need to get her worked up and assessed, treat her with some fluid, and get her onto CT. Yeah.
As the team works to stabilise the patient, Dr Staunton updates consultant Dave Walker.
So PA arrest, probably hypoxic. Witness collapse.
We can do anything better.
No.
The team has to make instant decisions without any access to her medical records.
We're getting the chest x-ray, probably get for CT.
So we don't know much about any history or anything?
No, literally nothing.
Part of my job is being able to assess a critically unwell person who comes in with limited information, being able to work out what's wrong with them and treat them successfully based on relatively limited information in a time-pressured setting.
But as Sister Amy is looking for ID, she finds something else. It's a sachet, often associated with drug use.
We should probably pat her down then, actually, to make sure she's not got any injuries on her.
So basically,
So guys, probably be quite careful until we've until we've patted her down, just to make sure no one gets a sharps injury.
We have seen an increase in presentation of patients with alcohol and drug-related problems. It would be very easy to judge these patients because a lot of people have a very chaotic lifestyle, lots of underlying issues and lots of problems that unfortunately haven't been able to get any help.
But treating the woman is proving difficult. As a suspected drug user, her veins aren't strong enough to take the fluid she needs to keep her blood pressure up.
Got something to stop this.
And there are more complications.
Probably had a cardiac arrest secondary because she's got poor blood flow, so she's stopped breathing and then that's caused her heart to stop beating as well. Because she's hit her head in the process of having a cardiac arrest. If she had a bleed in the brain as well, could kill her. So we want to make sure we scan her first and then here we go from here.
With no medical history and a suggestion of drug use, treating this patient will be far from straightforward. In resus, doctors are treating an unidentified woman who's been brought in after a cardiac arrest.
We don't know exactly what caused the cardiac arrest because we've not really got many details about her other than she collapsed. That's the next thing, to aim to find what the cause was, and then we can hopefully then treat it and stop it happening again.
Registrar Eamon Staunton is increasingly concerned about her condition.
Her blood pressure's a bit rubbish, so we're just getting her some infusions up. The type of breathing tube she's got in upgraded. So we're going to get her around to scan, but these bits always take a bit of time and she's becoming a little bit more unstable.
The patient is already on a ventilator, but they're worried that might not be enough. The team will insert a tube into her airway to support her breathing.
We optimised here, so bed at the right height for you. Venous access, we have two 18-gauge cannulas in the left hand, and we have a functioning right humeral IO. Fluid bolus, we've done and are doing. We've got some working laryngoscopes.
Yeah.
Yes, yeah.
Brilliant. We've got BT tubes ready.
Yeah.
Perfect. Does anybody have any concerns, or are we happy to proceed?
I'm happy.
Yeah, everyone happy? Cool. Nice and quiet.
You happy?
Keep it relaxed.
I think everyone who works in A&E likes making difficult, pressured decisions, but as long as we're providing a safe care for the most unwell patients, then that's all we can do.
Anaesthetist Dr Pachica carries out the intubation.
Keep an eye on the monitor, please, somebody.
Yeah, I've got my eye on it. It's the alarm.
Okay.
The patient's breathing stabilises, but her damaged veins mean she's still not taking in enough fluids.
Thinking of doing a central line because these cannulas are on bang off, so
yeah,
it's just this one is again gone off. So.
A central line will send fluids and medication straight into the patient's jugular vein. It's the best chance of giving her the treatment she needs.
What?
It's the hottest day on record, and in Casualty, everyone's feeling the heat.
It's too hot.
How many times are you going to keep saying it's too hot?
It is.
They're just trying to figure out which is best way to get some ventilation into the department and into waiting room, because obviously we're in like a big square, we've got no windows, no aircon or anything in here at the moment. I'm sending staff round every hour just to make sure that patients have got fresh, cool water in the room.
Sister Vicky gathers her team together.
Staff have just had plenty of drinks, patients have had plenty of drinks. Every hour we keep going round with water around for them just to make sure everything's okay. I'm absolutely exhausted and I've just had a week off as well.
Waiting in minor injuries is 51-year-old lead cutter Stephen. He sliced open 3 fingers in an accident at work.
Trying to move a bit of lead away from the saw blade as it was slowing down, and I didn't give enough time to stop. My fingers got caught in the saw. I think 2 out of 3 are bad. One's just got a slight cut on it, but these 2 fingers are pretty bad from what I saw.
Stephen, do you want to come this way?
You're looking a bit pale, are you okay? Are you not? Come on in, have a sit down.
Emergency nurse practitioner Jo is in charge of Stephen's care.
What's happened then, Stephen?
Got my finger in a saw.
In a saw, like a table?
Yes, massive saw, yeah.
Yeah, okay.
I'm cutting lead.
Yeah.
I'm trying to move a bit of lead away, the saw was still turning, and it's got my fingers in saw blade.
All right. Is it all the fingers?
The millet one's fine, that's just going to cut the extend tool.
Them two, really? Okay.
Patients who get injuries from electric saws or some other kind of machinery, and it is a very common hand injury that we see probably on a daily basis, I think.
Do you need anything for pain before I start doing anything?
Yeah, please, yeah.
Yeah? Right, so this drug, you're going to breathe it in. So just concentrate on doing some 10 big deep breaths in and out. So really suck it in. Make you more relaxed.
That's kicking in now.
Yeah. Can you feel me touching you here? Can you feel me touching you there? Yeah? Does that one bend at all? Right, just gently bend it for me. Just gently bend it. Can you just push against me? Okay. They've kind of got caught, them two, haven't they? There's a clean cut on that one, and then them two have just got caught. So I think you've been lucky. Yeah. You've got your fingers and you're moving them, so that's good. All right? You might have broken something. You might not. We'll soon find out.
There's one way to establish which, if any, of his fingers are broken.
So X-ray next, and then you'll be coming back to me and we'll see what result is of that. All right, so I'll see you in a minute.
Yeah, lovely, thank you.
Stephen's about to find out the true extent of the damage. In resus, the team is still treating a woman who's had a cardiac arrest.
Her condition currently is stable, but we're helping her a lot, so we're breathing for her. She can't keep her blood pressure up without the drugs that we're giving her.
But they're having trouble getting medicine into the patient's veins.
We need a cannula, that's what we call venous access, and she's particularly very difficult. So in that cases, we usually go for something called MAC line, which is like you're aiming to go for your jugular.
That's essentially like a cannula that we can use to give drugs to help keep her blood pressure up.
So we use this ultrasound machine to see where we are. I will stick a needle in it, I will put a catheter over the needle. It's a very tricky procedure, but if you got experience, you can do it very quickly.
If we were to give them drugs through the cannula, it would completely damage the vein, it would damage the arm, damage the tissues, it would essentially rot it away. But if we give it straight to the heart, then we can give much stronger drugs to help keep her blood pressure up and essentially then keep her heart beating.
The delicate procedure takes less than 5 minutes.
So secured a proper central line, and now she's getting some medication, so we don't need to worry about peripheral cannulas anymore because she's got a big decent MAC access.
With the patient's condition now stable, she can undergo a scan to check for bleeding on the brain.
In via CT, but then she'll get a bed on intensive care where they'll continue to ventilate her. As it stands at the minute, we don't know what the outcome will be and whether or not she will recover, but the fact that her heart is beating is much better, as obviously when she was in cardiac arrest it wasn't. So that's a good sign, but we will have to wait and see.
Casualty have done all they can. The patient will now be looked after by the team in intensive care. Lead cutter Stephen's waiting for his X-ray. He's sliced open 3 fingers on a circular saw.
It's that one. It's the one that's not been cut as much. That's one that's giving me some rage yet.
Stephen's on painkillers, but his professional pride's been hurt too.
I always said to myself, watch what you're doing, follow the procedures. Today was just one of them days where I didn't follow my own rules, of how to do stuff.
Accidents just happen, don't they, in a millisecond, and that's it then. If you're dealing with power tools and electric saws, I don't think I'd want to be anywhere near one.
Like that.
like that.
Yeah. Right. Bob your elbow down, rest it down. So I'm going to make it nice and straight. So which ones are cut?
Them 3.
Right, all 3 of them. Right, just a second. Nice and still there for me, love.
Radiographer Lucy takes the X-ray to reveal if Stephen's wounds are superficial or whether a bone's been broken.
No, my wife's from that.
A serious injury is something Stephen can't afford.
I don't get paid if I'm not working, so it's like I'm thinking to myself, how long is this going to take before I can go back to work and earn some money?
Stephen won't have long to wait for the answer.
Hey up, Emily, it's Vicky down in ED. You all right, love?
The heat is on in the hub.
Is there any chance that I could get an unregistered to just come and sit with a patient in CDU?
The temperature's rising, and so are the waiting times.
Start getting full of patients and things, that's when it heats up. And we were very short on staff as well this morning. So 9 registered when we should have 12. Just got to make sure that patients are safe, staff are safe. For me, just to try and support in all areas that I can do.
Still, there's no let-up in cases. 50-year-old Michael has been ambulanced in after collapsing at home. His family are worried he's had a seizure.
How are you feeling, Michael?
All right for now, yeah.
See how you feel when you stand. How do you feel when you stand up? How does that feel? Dizzy when you stand up? Yeah. Yeah, get yourself on there, yeah.
Michael was with his wife when he began to shake uncontrollably. She called an ambulance.
I got up this morning, went into the kitchen and sat down, then I felt faint, and then I collapsed on the floor. And apparently my wife seen it all, had a seizure. Still a bit weak, I still get these shakes every now and then, still shaky, you know what I mean? So, but that was scary, that. Never had one of them in my life before, never.
With symptoms like this, tests begin immediately. Nurse Dine starts by taking Michael's blood. Healthcare assistant Maxine administers an ECG to check his heart rhythm. Only then will they know the next step.
Yeah, cheers, love, thank you.
Let's go. You all right?
Yeah. In Miners, Stephen's about to get his X-ray results from emergency nurse practitioner Jo.
There you go, my love.
So, the one that you think is the least problem, you know, the ring one, you said it's not as bad, the wound's not as bad, but you've broken the bone there. You see that? Did you know that? Did she tell you that? Quite a bit of that bone's gone there. I don't know where it's gone to, it's probably still on blade. And because they are quite deep wounds and stuff, I'm going to refer you to hand specialist, which is at Sheffield, because they're going to need a clean out, a surgical washout and sort of microsurgery really to investigate the nerves and the structures that are in your finger. Because I think this will want fixing properly, and I don't know how they're going to do that. It might be that they put a screw in it to fix that, or they might just close it and hope that it will be okay. I'll dress them now anyway, and then I'll speak to them, get you some antibiotics, because obviously risk of infection, because we're not closing them straight away.
It's not the news Stephen was hoping for, and he's got something else to worry about. What's his wife going to say?
Wait for my wife to come and give me
Tell you off.
Oh, she's not happy with me.
Oh dear.
She's not happy with me. No, it's tough love. She's like, you know, it's your own bloody fault. You shouldn't have done it.
So when wife Debbie arrives, Jo puts in a word.
So first of all, he's going to need looking after. He was worried that he was going to get shouted at. I'm joking. He's got 3 deep lacerations, 2 to that finger and 1 to this, and he's broken the bone in that finger.
Next to his little...
His ring finger is broken there. I think he's been lucky, personally, because... But he could have lost his fingers and he hasn't. So we're focusing on positive, aren't we? So it's just going to be inconvenient for a few weeks, but he'll be back washing pots soon, I'm sure.
Stephen was operated on by hand surgeons in Sheffield the following morning. His wounds healed and he was back behind his saw after 12 weeks.
All right, thank you very much.
Back in the hub, the heat's causing havoc.
This one really doesn't need the lights on, does it? Because we've got enough sunshine at the moment anyway.
The hospital generator is struggling to cope with the heat, and staff are taking emergency action.
The outside temperature is roughly 40 degrees today. It's really, really hot. Obviously, it's having a massive effect on the hospital generator system. It's failing, basically. So we're trying to maintain the department on as minimal electricity as we possibly can.
To keep the generator going, Matron Hannah and Deputy Medical Director Jo are turning off all non-essential lights.
Let's see what we can switch the lights off.
We'll make you all sit in dark, sorry.
If we can find the light switches. We just need to keep as many lights switched off as we can for the next few hours. OK, so there's a bit of a problem with the hospital generator currently.
If the generator fails, the disruption would be felt far beyond the hub.
We do have emergency generators, but things like theatres potentially are normal. A lot of these computers would probably go off. So, yeah, we just really struggle to run our sort of core services.
There's record temperatures across the UK and the lights are going out in Casualty.
So we're just switching lights off to reduce the power that's being used on site. The generator's struggling a bit in the heat, so we're just a bit concerned that we might lose power to the site if we don't reduce demands.
Every little helps, but Jo knows she can't get carried away.
It's that balance, isn't it, of making sure it's still safe. I guess Resus is one of those places that we probably shouldn't be switching the lights off. But we should in rooms that have got windows in.
"50-year-old Michael's been admitted after he lost consciousness at home. Dr Lucy Blanchard has come to assess him.
So if you just recap what happened then, so you started feeling dizzy.
Yeah, I got up this morning, sat down at the table, and then I felt a bit dizzy, and then I just collapsed, hit the floor, and apparently they said I had a seizure.
Did you feel like you were going to faint?
Yeah, and then I was shaking, I can't stop shaking in the ambulance and that.
You felt like you had a temperature or headache?
He says I was a bit hot in the ambulance.
On the couch?
On a scorching day, doctors can't discount the possibility of heat stroke, a cause of dizziness. It can be life-threatening.
How did you feel? Did you feel confused?
I thought, what am I doing on the couch sort of thing, you know what I mean? Like I said, I've never had a seizure before, so I don't know what to expect.
Did you say how long it lasted for?
5 minutes.
And how long did it take for you to get back to normal after?
A minute or so.
Okay, so not very long at all.
No. I'm getting a lot of pain down here as well, back in my ear.
We'll have a good look in your ear.
Yeah,
See if we can see any infection.
Yeah.
We'll go from there.
Thank you very much. Thank you.
Thank you.
Thank you.
It's difficult to know whether they have actually had a seizure, so it's important to get lots of history so that you can piece things together and work out whether what they're telling you actually sounds like a seizure or whether it sounds like something else.
Dr Blanchard examines Michael's ear for clues to his dizziness.
So it's quite sore actually. Yeah, it looks like there's quite a lot of debris in there. There's not a big lot of wax though. No. It's possible that the canal of your ear's had a bit of an infection in, which is why it's got so much debris in there. Having an ear infection can make you feel a bit off balance as well, so I feel like there's quite a lot of things possibly making you feel a bit shaky. Okay. I'll go and have a look at your blood tests. I'll see if any of them have come back yet.
Okay, thank you.
Thanks. Usually, if you've had a seizure, you're quite confused afterwards. He said he was back to normal within about a minute, which isn't necessarily in keeping with a seizure. So I'm just having a look at his blood test now, seeing if I can find anything else that might explain why he's fainted.
While Dr Blanchard doesn't think Michael's had a seizure, she's still concerned.
We've got to assess them from top to toe, making sure that all the muscles are working, that they've not got any signs of anything going on in the brain that we need to do a scan for.
Further tests will reveal if there's a neurological problem, and Michael must wait for the results.
You are embracing the switching the lights off in here, aren't you?
Back in the hub, Consultant Jo is looking for more lights to turn off.
The hospital generator is running at 60 degrees, and apparently that's the point at which it could just suddenly lose power. Yeah, so we're switching what we can off. Everyone's working in darkness. I don't think we can make it much darker here than we have now.
No, I think it's got to be reasonable.
Yeah, we like it dark.
I think it's romantic.
Romantic, Anita? Do we need the music on?
No, turn that TV on. I've got one on the other side doing the same thing. No, I've just got on.
Oh, the music's still playing.
Madonna, you can't stop Madonna.
Oh, we can stop Madonna.
But the staff know if the generator fails, it'll be no laughing matter. Waiting in paediatrics is 13-year-old Abbie. Her Gran Lynn has brought her in after a freak accident at school.
I was sat on the floor outside the changing rooms, and when I got up, I knocked the fire extinguisher off the wall and it landed on my hand and broke my finger.
Abbie tried to put a brave face on it.
Everybody asking me if I was alright, and I went, yeah, I'm fine. And like a couple of seconds after I said I was fine, it started swelling up and hurting. They took me for an x-ray, and that's when I knew I broke bottom of my finger, top of my finger.
Dr Evelyn Q wants to give her a dose of antibiotics.
Do you want to know when it goes in or not? Bless you.
But Abbie has a needle phobia.
You're doing really well, okay. It'll be short for a second and then it'll be over.
It's what they all live. It's true.
Dr Q's brought her best bedside manner.
Very still for me. Well done.
But Abbie can't help herself.
Let me get one of the nurses. They're very good at this.
Reinforcements arrive in the shape of paediatric nurse practitioner Angeline and her magic spray.
Are you ready? Right, let's do some really cold spray. You ready? Really cold. There we go. And that makes it complete. And then we'll just try and keep really, really still. Do you want to look the other way? Well done. That's it. Well done.
Well done.
Just try and keep that arm really still, sweetheart. Well done. Amazing.
Just breathe.
Perfect.
Finally, success.
Almost done, sweetheart. Well done.
2, 3, 4.
That's the easy bit over. Now Abbie has to wait for the results of her x-ray. There's more needlework in cubicle 18, where Nurse Eve has medication to help Michael's dizziness.
Hi, love.
And so I've just got a little injection for you, Michael.
Yeah.
It's going to go in the muscle of your arm, okay?
Yeah.
So this just prevents any further seizures,
Oh,
alright?
right, yeah.
Alright?
Yeah, that's fine, love.
There you are. Well done.
Thank you. Thank you, love.
Dr Blanchard has Michael's blood test and heart tracing results, and it seems her suspicions about his ear were well founded.
It looks like he's potentially got an infection going on in there. Very rarely an ear infection can spread to the brain and create an intracranial infection which could cause a seizure, so I'm not concerned about that at the moment.
Dr Blanchard shares the good news with Michael.
Hello.
Hello,
How
love.
are you feeling?
Oh, I had that injection.
Has it made any difference, the injection? Yeah, you feel a bit better? Good. Okay. So I've had a look at all the results and things. Everything's come back completely normal. Yeah.
Weird.
From what you've described to me, it doesn't sound like you've had a seizure. I think this is potentially all linked to your ear. So the injection helps with dizziness caused by problems with your ear.
Right.
So it was a bit of a trial to see how you feel.
Yeah.
I just wanted to see if I could get you back up again and see how you are on your feet.
Yep.
And then we can hopefully get you home. Oh, you're a lot more steady, aren't you? Yeah. Do you mind just having a walk out there and we can see how you're doing?
Oh, dear me.
How do you feel?
Yeah, it's a bit better.
A bit better.
Yeah.
Can you walk with your heel in front of you?
Oops.
Dr Blanchard is pleased with how Michael's responding to his treatment.
We can give you some medication, the same as what we've given you as an injection.
Yeah,
You can have it for 3 times a day and see if it helps with the unsteady feeling. but I don't think you need any more investigations into it. I think that Michael has suffered from a simple faint, otherwise known as a vasovagal. When I took the history and examined him, there was nothing concerning suggesting that it might have been a seizure. He responded really well to the medication for his ear, so I've given him some of that to take home and advised him to see his GP, and hopefully he makes a good recovery.
Yeah, bye-bye. Back on his feet and armed with his medication, Michael was discharged.
Cheers, thank you. See you.
Thank you, bye-bye. While he's currently waiting for a precautionary CT scan, he's had no further issues.
You are embracing the switching the lights off in here, aren't you? Yeah.
Back in the hub, matron Hannah and consultant Jo have turned off pretty much everything they can think of.
Paediatrics have massively embraced the darkness.
The generator's holding up, and so are the staff.
We've gone round, switched what we can off. I think we need to leave the fans running because it's red hot for all the patients.
In the intense heat, Hannah's had to take emergency action of her own.
So what's happened to your matron uniform?
Oh, Jo, it's just too hot, it's too thick, it's too heavy, the tights.
Yeah.
And it's 40 degrees.
Yeah, I get that.
Scrubs are much more comfortable.
At last, the light monitors get their reward.
Cold drinks. So these are what the trust is supplying us because of the hot weather to keep staff hydrated.
It's not normally this hot in Barnsley.
Suddenly, there's another emergency to deal with. 64-year-old Mark has just been brought in by paramedics.
Or I think I've broken my wrist. I shall find out shortly, I suppose, when these have had a look at it, but it looks very misshapen to me. I'm a refrigeration engineer and I was lifting a freezer up and I lost the grip on it and it knocked me to the floor and it hurt.
Mark is just 4 weeks away from retirement. It's not the leaving present he was hoping for.
I can't tap dance.
Shall we do ballet instead? Bit of street dance or jazz?
Nurse Amy gives Mark some strong pain relief before he goes to X-ray.
Should be all right, 'cause I've been having some of this.
The scan will reveal if Mark's broken his wrist and whether he'll require surgery.
Just have a look.
Are you going to lift it out? You've got to lift it out, haven't
I'm
you?
going to slide this off. Support your wrist.
It's proving a painful process, and the swelling in his wrist suggests the fracture's serious. X-ray done, Mark will soon find out if he needs an operation.
I've got to put some strong stuff in that needle.
There's more trouble in the hub. The generator's been saved, but temperatures continue to rise. Sister Vicky's growing concerned.
Just going to have to keep maintaining plenty of fluids for his patients and his staff and just try and get through it as we can.
Luckily, she can count on volunteer Jane.
We've got his water there and some cups. So anybody down here can constantly have drinks.
It takes more than a bit of sun to stop Jane reporting for duty.
They did send us an email so that we'd no need to come in if we didn't want to, but quite frankly, I'm afraid that this could be the day that they need extra hands. Because they'll be getting tired quicker. You know, when they've been working all day in these extreme heats. I mean, just these that's doing, 9 and 10 hours. They're going to get really tired really quicker, aren't they?
But on a day like today, even the water cooler's struggling to cope.
It's like waiting to be young for that to come out.
Meanwhile, Mark's had the news he's been dreading. His wrist is broken, and now the emergency nurse practitioner team must attempt to reset the fracture.
Right, then, can we get you onto this bed? So you pop yourself, that's it, go up there way, straight to edge. That's it. Great. Now let's get your legs up. Put it up there. There you go. Right.
Nurse practitioner Becky is on hand to assist. She's hoping they can avoid surgery.
So it's not in the best of states, to be fair. So it's what we call it's quite angulated and displaced. If we can prevent that patient coming in and having an operation, then we will. So many a time, that's all they need doing. They'll not need to come back for surgery. So ultimately, in the long run, it's better for them.
Mark's eager to get it over with.
Just do what you've got to do.
He's every confidence in Nurse Practitioner David.
Where's the doctor from?
Me, I'm from about 2 mile that road.
Proper Barnsley lad.
So, it's broke here, but it's squashed together as well. And what that's caused it to do is move out of line, so that's why we need to straighten it. Yeah. Alright? So we need to make it less painful for you. So I'm going to pop an injection in to numb that. Is that alright with you?
Yep.
Yep. Can you get it so your arm's on there? Or not? Right, wait a minute, I need to just...
Yeah.
This is going to feel tighter when I first start because I'm putting into a swollen wrist even more fluid. But once it's in, it'll start to ease off.
Okay.
Is that okay?
Yep.
Bear with me. Right, are you ready? Sharp stop. Right, bear with me. It will feel tighter as it's going in, but I promise you within a few seconds of it going in, it will settle down. Alright?
Talk about tight, yeah.
I know. It will start to ease off though, because once it's in local anaesthetic, it starts to work.
You're not wrong.
So I'm just going to give you a couple of minutes now. Alright?
But anaesthetic's not enough. More pain relief is required.
Hurting the job.
Oh, I don't know.
You're going to hurt me.
Am I going to hurt you? I hope not. I think everybody's different, aren't they? Everybody's got a different pain threshold, but yeah, absolutely. I wouldn't like to think that that were me, that somebody were pulling on my wrists.
So next thing you're going to do is you're going to breathe on some stuff, alright? It's an anaesthetic drug. You'll feel a bit like you've had a few pints potentially. Right, have a little breathing into that. It'll make you cough potentially, but that's quite normal. Don't worry too much about that. That's it. Right, have another couple of breaths now. You alright with it? That's all you need to do. Keep breathing it in and out.
Pain is what the patient says it is, whether it be severe or none. Everybody has a different meaning of pain and how they cope with it. And it's our job to minimise that as much as we possibly can.
It only takes a few breaths to wear off, so don't stop, just keep breathing. What does your wrist feel like?
Shaky.
Shaky. Is it painful like it were before?
No.
No?
I'm getting there.
Right, that's it. Another few breaths then. That's a big drink.
Toes are getting tingly now.
Starting to work then when you leave here then.
I've not heard that one before, have you?
Keep going, baby.
That's it, keep going. That's it.
The team is about to begin the delicate task of manipulating Mark's bones back into position. He's praying the pain relief does its job.
You lift your arm up.
Arm up.
You've got a drink, haven't you, sweetheart? Are you drinking it?
As temperatures hit 40 degrees, volunteer Jane's leading the fight against thirst.
Hottest day year today. We've got to make sure everybody's got a drink when it's hot.
The hospital chief executive, Richard, has come down to check how the staff are bearing up.
Sweetheart! You all right?
Yes, you?
Oh, we're bearing up under straight. You look very cool, very calm and very...
Cool now I'm here, I wasn't cool in my office.
Oh, so that's why you've come out to slum it with us lot.
Volunteer Jane appreciates the visit.
It's nice for you to come down though, sweetheart, in our hour of need.
There's an even more welcome arrival.
Thank you so much.
These are for PEDS and CDU, they're for everybody.
The ice pops take the heat off volunteer Jane and Sister Vicky.
Vicky's cool.
Cool as a cucumber. I am.
Refrigeration engineer Mark was just 4 weeks from retirement when he broke his wrist at work.
That's it, just keep breathing. What's it feel like here?
All right.
Keep going, baby.
Keep going.
Keep breathing.
Nurse practitioner David is manipulating the bones with the help of Nurse Becky and some powerful pain relief.
Better now, yeah.
Keep going for me.
Fabulous. Keep going. Doing really well. Go on, deep breaths. Wonderful. Keep going.
Yeah. And there's a massive fragment in that trouble. It's massive.
The next step is to pop the arm.
There's one last little bit.
Give a minute.
You've not done yet.
We ain't quite finished though, yeah?
No.
There's a last little bit to do in a second.
If Mark stops inhaling, the pain relief will wear off in seconds.
It's like that 1 foot road. That's what you're on now.
Go on, keep going.
Keep going now, because this is the bit that you need it for. Are you ready? Keep going.
Slower, that's it, wonderful, keep going. Pop this back in. Keep your lips nice and firm round it. Go on, breathe out. Chew it. Breathe out.
I'm
What?
it's still there a bit.
Your arm's still there, don't worry, it hasn't fell off. Don't worry, it's still there.
The pot's on and the bones realigned.
That's it now. So let's just rest that back on there for you. Right, you're gonna have 2 minutes.
Yeah.
Right, I'm gonna turn that off you now. Because whenever you breathe, it don't wear off. You'll just relax there for 2 minutes, alright? Alright?
Thank you. Look, I know you're really.
Oh, you're very welcome, Alan. You were very brave. You did very well. Yeah.
You said you were going to pass out, you didn't pass out, so that's what we need to start with.
It's time for Mark to sober up.
Right, all you need to do is just sit up and drop your legs up the side here.
The bones are back in place, but will it be enough to avoid surgery?
The problem we've got is there is a chunk of bone that's come off. So that is going to be a problem.
Yeah, just rough and take it out.
Well, put this back on, just for X-ray. It's possibly going to need an operation, so we're going to have to speak to bone doctors about it for that reason. Alright, but we'll see what position looks like.
Further x-rays showed the manipulation had worked and Mark didn't need an operation.
Thank you. See you later.
Instead, he underwent a course of physiotherapy, and while the wrist remains a little stiff, he now says he's fine. 13-year-old Abbie broke a finger when she dropped a fire extinguisher on it at school. Dr Q's assessing her x-ray, and it's not an easy fix.
We can see that there's a break here. This is the obvious one here, and there's also a tiny one that they can see at the end of the finger. What we'd want to do is essentially to align these bones together so that they can heal up properly. When the finger breaks sort of completely like that, there's a risk of it sort of rotating as well, so the whole bone could be rotated. And that's what's making it more complex. It's not just joining two pieces together. Because this is sort of a more complex fracture, we will send the patient to the Sheffield hospital so that they can have a closer look at it.
We're going to hold hands.
Abbie's hand will need supporting till she sees the specialist.
Is that all right so far?
Yeah.
Can you see why I didn't go for the tighter one?
Yeah.
The cast will keep the hand still and stop the bones moving further apart.
Sorry, sweetheart, I'm just trying to make this as tight as I can get it. Now, what I'm going to do next is a bit messy. Ready? Sorry. Is that nice and warm?
Yeah.
It's nice. Sorry, sweetheart. Okay, that will take a minute to set, so if you just leave it there, I'll wipe you down with a wipe so you're not covered. Right, I'm going to go first copy the notes, come back in about 5-10 minutes, make sure it's definitely set, which it should have done, and I'll give you notes so that when you are ready to go, we can just get you off. Yeah. All right?
Abbie underwent surgery at Sheffield Children's Hospital 2 days later. The pin they put into her broken finger has now been removed, and her hand is healing well.
I have to have a look at waiting room, but I think everybody's...
The hottest day on record is drawing to a close. Volunteer Jane is delivering her final drinks of the day.
Who's going home? I'm on babysitting duty for my beautiful granddaughter. It'll be paddling pool and sandpit under Brolly.
For Sister Vicky, it's been a tough shift, but she's got through it.
I'm absolutely shattered. I can't wait to get home and just chill out. Today's been really, really busy. We've just not had any flow within the department, Dr Wade. But all in all, say it's one of the hottest days of the year. The team's been absolutely amazing. They've really pulled through. They've not stopped, bless them. It has been continuous and relentless, but they just carry on. They're brilliant.
It's been a long day, but at least there's a reward at the end of it.
Oh, you bloody star you are.
The heat's finally off, and tomorrow they'll be back for more, hopefully a little cooler. Next time on Casualty 24/7.
We know that they're in a lot of pain. You're minimising a risk of infection also, which is a huge issue with burns.
We're aiming to get your heart rate up to about 40 beats a minute, and once we've got it to about 40 beats, we'll be happy.
busy, lots of problems, but we'll get on top of it. It's just a bit hectic at the moment.
Catch all that new next Monday at 9. And if you or someone you know has been affected by any of the issues raised in tonight's programme, please go to channel5.com/helplines for information and support. What led one family to live off-grid on a remote island in the Azores? Ben Fogle finds out in New Lives in the Wild tomorrow at 9. Next, new 999 emergency call-out.